Hey everyone, welcome to today's Explainer. Today we're diving into something that's honestly deeply personal, super sensitive, and for a lot of folks just an absolute cornerstone of their everyday health. We're talking about long-term bladder drainage. Specifically, we're zeroing in on suprapubic catheter placement, really looking at it as a guide to getting your comfort and dignity back. Look, if you or someone you love is navigating the whole maze of chronic bladder issues, I want to validate right out of the gate, this is a heavy subject. But stick with me, because by the end of this explainer, you're going to understand a seriously advanced, minimally invasive option that is literally changing the way patients live their daily lives.
So I want you to just sit with this question for a second. What if long-term bladder drainage didn't mean losing your comfort and dignity? I mean, for way too many patients, the medical necessity of a catheter comes with this huge, heavy toll. It's not just the physical discomfort, right? It's the emotional weight. It's the fear of leaving the house, the constant nagging anxiety about hygiene, that awful feeling that your condition is driving the bus rather than you actually living your life. We really need to acknowledge that the physical discomfort is kind of just half the battle here.
Section 1. The daily catheter struggle and limitations.
Okay, let's really dive into this. If you're dealing with long-term catheter needs right now, your day-to-day reality might be incredibly frustrating. And it is totally normal to feel overwhelmed when standard medical fixes seem to cause almost as many problems as they solve. The reality of long-term urethral catheters is harsh. No two ways about it. When you can't urinate normally and have to rely on a standard tube through the urethra, man, the side effects pile up fast. We're talking severe discomfort and chronic irritation of some highly sensitive tissues. You're looking at a huge risk of recurrent infections that completely disrupt your life and keep sending you back to the clinic. And way beyond the medical chart, this impacts intimacy, it restricts your mobility, and it just tanks your overall quality of life. Over the long haul, it often feels like a massive burden.
And this daily struggle? It builds into a major dilemma. Traditionally, you might be handed two main workarounds. First up, intermittent self-catheterization. Now this works, but let's be real here. It's simply not physically possible for everybody. It takes manual dexterity, plus you have to manage it constantly throughout the day. The other option? The long-term urethral or Foley catheter. Like we just said, while it totally works as a temporary fix, leaving that thing in long-term brings a huge risk of chronic irritation, nonstop discomfort, and infections. So patients just end up feeling stuck between a rock and a hard place. Section 2. The modern alternative, suprapubic catheter, or SPC, placement.
But what if there's a door number 3? Well, there is, and it's a brilliant, really elegant workaround that completely avoids the whole problem area. So what exactly is a suprapubic catheter? Basically, it's a small, flexible tube. But here's the game changer. Instead of going through the highly sensitive urethra, it's placed through the skin of your lower abdomen directly into the bladder to drain urine. By completely bypassing the urethra, you instantly eliminate the main source of all that friction, pain, and irritation. It gives you reliable, comfortable drainage while totally preserving that sensitive urethral tissue.
I know, it sounds fantastic in theory, right? But I know exactly what you might be thinking. An abdominal catheter? Wow, that sounds pretty intimidating. So, how does this actually work? Let's take a quick breath, reset for a second, and look at the actual clinical steps, because I promise you, it is way less daunting than you probably imagine.
Section 3. Demystifying the procedure.
All right, first things first, you need to know this is absolutely not major open surgery. It's a highly precise, minimally invasive procedure usually done by a specialized doctor called an interventional radiologist. And honestly, this brilliantly illustrates how amazing modern medicine is right now. These specialists use what's basically an advanced medical GPS. They aren't going in blind or guessing. They use live x-rays and ultrasound to see exactly what's happening inside your body in real time, which lets them navigate safely and perfectly straight to the bladder. So here's exactly how it goes down in 4 simple steps. Step 1. You get some sedation and local anesthesia, so you're completely comfortable and relaxed. Step 2. They safely fill the bladder with fluid. This is actually a really clever trick because it sort of inflates the bladder, lifting it away from nearby structures and making it a super clear, safe target. Step 3, using that ultrasound and live x-ray guidance we talked about, a needle is carefully guided through a tiny little puncture in the lower abdomen skin directly into the bladder. And finally, step 4, a thin wire goes through the needle, the catheter slides safely right over that wire, and a tiny balloon at the tip gets inflated to hold it securely inside the bladder so it definitely won't slip out. It's precise, it's clean, and it's incredibly controlled. And you know what the most reassuring part of all this is? This number right here, 30 to 60. The entire procedure usually only takes 30 to 60 minutes. That's it. Once it's in place, the catheter just connects to a drainage bag or a valve. It is a remarkably fast and efficient process for something that offers such massive long-term relief.
Section 4. The lifestyle return.
Okay, so the clinical steps are super interesting, but what really matters at the end of the day is the after. Notice how these clinical benefits translate directly into real human benefits. Over on the left, the traditional urethral catheter brings chronic irritation, constant discomfort, and massive limits on your mobility and intimacy. But look over at the right. With a suprapubic catheter, because you bypass the urethral completely, you get long-term comfort. It's way easier to keep clean and manage your daily hygiene. It's vastly more compatible with intimacy, and above all else, it preserves the dignity of patients who rely on long-term drainage.
And recovery is highly manageable. Usually it's just an outpatient visit or a very short stay. You might have some mild soreness at the insertion site for a couple of days, but it's super easy to manage. Best of all, you or your family will learn really simple at-home dressing care. After that, it's just quick, routine tube exchanges every 4 to 8 weeks to make sure nothing gets blocked. Honestly, most patients adapt incredibly fast to this simple routine and get right back to their daily activities, finally totally free from that constant nagging irritation they used to just have to endure.
So who is actually a good candidate for this? Well, looking at this list, you might actually be self-identifying right now. It's an awesome option for patients with a neurogenic bladder, which can happen after a spinal cord injury or with conditions like MS. It's also great for folks dealing with urethral strictures or chronic prostate-related blockages. Basically, if you need long-term bladder drainage and you're dealing with pain, discomfort, or complications from traditional catheters, and you really value your comfort, your hygiene, and your dignity, this option was designed for you.
Section 5. Taking the next step.
Look, understanding your options is really just step one. Actually acting on them is how you reclaim your life. As this quote hits the nail on the head, every patient is different, so the best next step is a conversation with your care team to see if this is right for you. You'll want a consultation with an interventional radiologist and your current doctors to figure out if you're a good candidate. They're going to look at your specific medical history and help you make a really informed, totally confident decision.
And when you're looking for the right experts to actually have that conversation with, facilities like IR centers specialize in exactly this kind of thing. Their interventional radiologists are absolute leaders in advanced, minimally invasive care. Their whole focus is giving patients access to non-surgical alternatives that actually prioritize your quality of life.
The bottom line is you absolutely do not have to just settle for constant discomfort. There are modern, incredibly elegant solutions out there that can genuinely restore your freedom. Talk to your care team, explore your options, and take that step toward a far more comfortable life. Thanks so much for hanging out with me for this explainer. I want to leave you with one final, pretty powerful thought to chew on. Are you ready to stop letting your urethral catheter dictate your life and finally reclaim your dignity?